Cognitive Behavioral Therapy, written by Richard Kroon, narrated by DMS. Introduction. CBT is a proven approach to comprehending and dealing with psychological problems. It is a formal, constructive form of therapy by which the client's expectations are initially set and discussed during treatment. CBT's goal is to help people resolve their emotional problems by assisting them to recognize and change their thinking action. The term cognitive applies to mind, mission, memory, and attention. The mental problems individuals may face with CBT are different, such as stress, phobias, or anxiety. Also, behaviors that may be consequences of actions, and what leads to such emotional difficulties may vary. They include reduced stress levels of activity, prevention of social situations, and excessive cleaning. For instance, someone who considers himself as a disappointment can feel ashamed and discouraged and avoid others. Such coping behavior could then strengthen interpretations and distress. Avoiding others, for example, gives the person less chance to get positive feedback from everyone else. This way, the person gets stuck in a vicious cycle. The cognitive behavioral approach suggests that people in their current lives will recognize these vicious cycles and then adjust their thoughts and behaviors to decrease their distress. For instance, choosing times where they can meet others' behavior and thus receive positive reinforcement, which then affects their perception of themselves, cognition. Helping clients recognize the underlying roots of such meanings and coping strategies may send them the impression that, given their past experiences, their beliefs and behaviors can be seen as acceptable consequences, while also recognizing that such beliefs and behaviors may not be the most useful ones today. Therapy can thus be an incentive for the person to establish beliefs and attitudes that are more beneficial in their current circumstances as they bring less anxiety or damage to them. CBT has been tested for a wide range of clinical conditions, and proof of its usefulness with stress, nausea, agoraphobia, generalized anxiety disorder has been discovered. CBT growth keeps on going. Some innovations are being created and studied. For example, extending its use to people with personality disorder diagnosis, integrating mindfulness practice.
Sample complete. Ready to continue?